Addiction and mental illness, in terms of two particular conditions that we're looking for, obviously, is anxiety and depression. Oftentimes, alcohol is used to assuage symptoms of a medical condition. That is to say, that alcohol is used as a medication to decrease anxiety. Oftentimes, we use alcohol, or patients use alcohol, because they have rushing thoughts or anxiety, inability to sleep at night, so they will begin using alcohol in ever increasing amounts so that they can at least get some rest. In reality, what's happening is they're disrupting their sleep cycles, because the use of alcohol prevents the brain from resting and prevents the brain from getting into a REM4 sleep. What it's doing is knocking the patient out so that they believe they're resting, but what happens is you'll wake up fatigued and more fatigued and become more and more anxious, and the only way to fix that is by consuming more alcohol. So that then becomes the cycle of using medication to either decrease the anxiety or depression, and the increasing cycle then develops the dependency on the use of a substance to assist with their mental illness. It's extremely common that patients at a very early age, most of the patients here, have begun using something at an early age. Age of onset for us is about year 14, where our patients are using alcohol or marijuana to decrease symptoms. What we've found here is the most common symptoms for our patients, for sure, is anxiety and attention deficit hyperactivity disorder for males. So we have the combination of anxiety, ADHD, and addiction. All three seem to go together with males. So what we have to do is be able to treat that co-occurring condition by addressing both the addiction issues, which is a neurobiological, as well as the psychological issues of anxiety and depression at the same time, because as you decrease one, the other two may increase. That's co-occurring. So what you have to do is be able to treat the whole patient for all of those symptoms, or all three of those conditions at the same time, so that the patient gets stable and healthy through an extended period of time. And that takes a great deal of sophistication, and through an extended period of time, oftentimes in excess of 12 to 18 months.